Hello, I'm Dr. Manoj Bhatawdekar. I'm a psychiatrist. In this series on wise parenting, we have been talking about the development of preschoolers. Earlier, we saw the differences between normal and abnormal. Of course, we do not want to label any child as abnormal, but it is important for us to know about certain conditions which can present at this age, which can be serious, and which, if detected early, can have a better outcome because we can plan early treatment, early intervention. There is a 2-year-old boy who's brought by his parents for assessment, and these parents have noticed certain behavior in this child. First of all, they noticed that this child's milestones were in general all right, but certain milestones have not developed at all. This child has started walking, getting up on his own, moving about, but is not talking. His language is not developed. Also, his social milestones are delayed. This child is not able to interact socially. This child is interested in things rather than people. So he deals with people as if they are non-living. So what are the symptoms which these parents have noticed in their child? This child keeps to himself. He doesn't mix around. He doesn't look at people. He's not able to communicate socially. There is no speech. There is no initiation of any conversation or communication. He deals with people as if they are non-living. He cannot play meaningfully with his toys. For example, if there's a car, instead of riding the car on the floor, he just transfers it from one hand to the other as if not knowing what to do with it. This child hates loud noises. He reacts, he screams if there is a loud noise. He hates strong smells. He hates to be cuddled, picked up, or hugged. This child is not able to climb stairs properly. He cannot focus on a task. He is hyperactive, carrying out useless movements with his limbs. Maybe he whirls around himself and seems to enjoy that movement. There is some kind of self-stimulation with the help of some stereotyped movements with his limbs, like maybe flapping or doing something like this. You stop this child from doing this, the child reacts violently. What is wrong with this child? This child suffers from a neurodevelopmental disorder called autistic spectrum disorder. It's not a disease. It is not caused by a particular thing. It starts unfolding itself as the child grows in age. And this child has a serious pervasive problem because the child behaves exactly the same way wherever he is. These children very often find it very difficult to adjust in a school environment because of their lack of language development and because of their lack of social reciprocity. These children, if left to themselves, do not improve. It's not a condition which the child will outgrow as the child grows old. Therefore, we need to intervene early. What kind of interventions are needed for a child with autistic spectrum disorder? Well, occupational therapy is the core of early intervention. So, what is done in occupational therapy? An occupational therapist deals basically with the sensory and motor issues of children. These children have several sensory issues, and sensory integration is the kind of therapy that they need. There are also certain motor exercises which are helpful. As the child stabilizes on occupational therapy, speech therapy is started and the child's language starts improving. A basic determinant of success is the motivation of parents. how motivated they are to take this child on a regular basis for months together to an occupational therapist. Another important determinant is the child's intelligence, the child's IQ. Children with a higher IQ and autistic spectrum disorder do better as compared to those with a lower IQ. These children have this disorder because of certain genetic factors, certain environmental factors. They need to be assessed in detail, and a regular plan of therapy with periodic follow ups is drawn. Mind you, it's not easy to deal with a child with autistic spectrum disorder. Sometimes, at a later stage, they might require certain medications for their hyperactivity, for their irritability, for their emotional disturbances. So, the point is, we need to detect this disorder in its early stage so that early intervention and early treatment is possible and the outcome improves. We are not trying to scare you with serious diagnosis. All we are trying to say here is please look out for these symptoms if they are present in your child and consult a professional doctor.